So the purpose behind this particular type of town hall is to introduce newly funded projects, and we interpret the word newly in a pretty broad sense. The idea is that so often we know a little bit about what our colleagues are doing, but we don't really hear in depth about it until sometimes years later, and sometimes years after they finish a project, when they either publish it or present once we've done the findings. So what we do this this type of town hall to let people know what's been funded and what's happening now. And so that's what, and we put together sort of a random potluck of just 3 projects, and not necessarily in a theme, but so we are happy to have 3 projects that will be shared with us today. So I'm going to first introduce Sophia Zamudio-Haas, who's going to present on 2 of the projects. And then on the 3rd project is going to be Emily Arnold and Lucia Abascal. And Lucia, please tell me if I have your name close to correct, my pronunciations.
No, that was actually perfect.
Okay, well, Emily helped. So but I still have a way of hearing it correctly and then saying it wrong. So hopefully, yeah, good. All right, great. So why don't we will start in each of the presentations. I think Rochelle's going to keep time for us because often, and we'll try to, depending on how well we stay on time, we may have time for questions between. If not, we'll have questions at the end. And then certainly, especially those who have already presented, if you mind the chat, you can probably handle some questions in the chat after you've done your talk as well. So, okay, let's start with our first speaker. Dr. Sophia Zamudio-Haas is a qualitative researcher and assistant professor in the Division of Prevention Science and here at the Center for AIDS Prevention Studies. She specializes in community-based participatory research methods, received her master's in science from Harvard School of Public Health with a concentration of women, gender, and health, and her doctorate in public health from UC Berkeley. She's led and collaborated on research, HIV research and health system strengthening projects in 15 different country contexts and speaks Spanish and Portuguese. Her work focuses on exploring the ways in which people overcome extreme adversity to survive and thrive while changing systems that seek to marginalize and oppress difference. Dr. Zamudio-Haas's interests lie in increasing access and uptake to HIV prevention and treatment services for most affected populations in the US and globally, including gender and sexual minorities, people who inject drugs, and young women and girls. Engaging participatory and community-led methods, as well as quality improvement strategies. Her work focuses on generating innovations and adapting care programs to meet the needs of marginalized populations with the goal of reducing HIV health disparities. Her research focuses on increasing access to culturally tailored and population-specific HIV prevention and care services for transgender women. So, and rather than tell you what Sophia is going to be talking about, I will let her tell us what she is going to talk about. So take it away, Sophia.
Great, thank you, Mallory, for that fantastic introduction. No, I'm only joking because I know I had a hand in that. So thank you for that, and to Rochelle for inviting me to share today, and also for organizing this forum to present on newly funded projects. And great to have everyone here virtually over Zoom. There was like a little discussion when we were planning this, will we be doing this at Mission Hall or will we be doing this virtually? And I think one real advantage to doing over Zoom is that people can really join fairly easily wherever you are across context and time zones and that. So today, as Mallory had said, I'll be presenting on 2 newly funded projects, and they're distinct and separate projects, and yet they both speak to the need for HIV programming, tailored education and messaging to reach women with needed services. And here I have a PrEP photo, and I'll get into that a little bit more. So Both of these studies, one second here, both of these studies are funded through programs for early career investigators. And that term refers to investigators who are within 10 years of completing their terminal degree or their doctorate. People can have a postdoctorate appointment, or as in my case, kind of an entry assistant faculty appointment. And the first one that I'll present on is through the Population Health and Health Equity Scholars Program at UCSF. And the second project is funded through the HIV Prevention Trial Network Domestic Scholars Program. They also have an international scholars program, and I'm happy to, respond or dialogue with anyone who might be interested in applying for these two programs in the future. I am so glad to have them, and they're both really geared towards moving forward investigators, early career investigators on their career path, and fund kind of small projects that are both connected and really benefiting from larger studies, and include protected time as well as study costs. So it's a little different than your typical study funding mechanism, because it really is intended to, both of them are intended to provide networking opportunities, mentorship, and also protected time. So I thought I would just highlight that. And the first one that I'll present on is funded through the Population Health and Health Equity Scholars Program. And this is to build on and really extend ongoing research with La Clinica de La Raza in Oakland, California, and UCSF. This particular project focuses on developing culturally tailored HIV health communication materials for transgender women. And the photo that I have here for Triunfo, this was part of the project that really seeded a constellation of work between collaborations between UCSF and La Clinica. This is a photo of the initial study team for a PrEP project that also established a gender care clinic within La Clinica that provides hormone therapy to transgender people. And so this current study is part of an overall project with PI Greg Rebchuk that is looking at strategies for status neutral approaches to HIV care and services. So the study team for this project at La Clinica, we have Tara Gonzalez, who is the primary care physician and PI for it, Lorena Martinez Hernandez, who is a health educator, Carmen Foster, who leads Trucha, which is their community health education projects. On the UCSF side, it's Luz Venegas, myself, and Greg. And yes, so that's excellent. And then, again, building on that initial work with PI Jay Sebelius and our group there. So I just wanted to share a little bit of an anecdote for one of the seeds of this project. It was an interview actually that Luz and myself had co-facilitated with a young trans woman who had gone to Oakland City Schools. So she'd finished high school within Oakland, and she had been part of the PrEP program initially. And we were talking about the need for, what would be her vision? What would she really want out of a comprehensive status neutral program? And she said, HIV education, straightforward. And as we talked more in depth about that, it turns out that her HIV education had been really limited to what she had received after she was already kind of interested in PrEP. And that within her high school, where sex education is required by the state, the curriculum for that covered really focused on pregnancy prevention. And so just to kind of paraphrase her words, she was like, I'm not worried about getting pregnant, so none of it really applied to me. And it became clear also through these initial interviews that that when we were talking with trans women who are living with HIV, they really started learning about HIV after their diagnosis. And that lack of information around HIV prevention, HIV care and treatment fuels HIV stigma. And it also keeps people away from services that could really benefit their health and well-being. So, just to kind of summarize the rationale for this study, trans women continue to experience really the heaviest rates of new HIV infection, also shoulder a lot of prevalence, particularly African-American and Latinx trans women. There's a need for not only education materials and informational materials, but also program promotional materials that really speak to the desires and appeal to trans women themselves. And that's why, I continue to highlight those promotional materials that were developed as part of that first Triunfo program, because they really highlight, they're beautiful pictures. They're also uplifting pictures. They're inviting pictures. You kind of wonder like, okay, what are these? These ladies look like they're having fun. What are they up to? They're really inviting participation within a program. And still, too often HIV, both prevention, PrEP materials, and care and treatment materials erroneously group trans women with men who have sex with men. So essentially it's a men's program and then they tack on and trans women are welcome as well, which doesn't really make, for a very inviting program. So it's really, when I'm talking about health communication materials, it's educational materials, but it's also even our very own program flyers and health clinic promotional information. And finally, a real lack of information in Spanish. So this is, again, a small study that is nested within a larger one. We have two very specific aims, I guess I would say. And one is to develop Spanish and English language materials that are really, again, using status neutral approaches to cover testing, PrEP, ART, in Spanish and English, and then to really refine and tailor these materials through focus group discussions, and also to pilot them as part of this kind of constellation of studies collaboration between UCSF and La Clinica. Here I have just a very kind of big picture diagram of the study design. So as I said, this does build on our ongoing work. So we've conducted about 20, meaning again, Luz and myself have conducted about 20 interviews. So we'll draw on those interviews, analyze them as part of our collaborative team with La Clinica to develop messages and materials that really fit the needs that are being described and expressed in these interviews. And then use focus group discussions to workshop and refine these materials with the participants, with trans women, Spanish speaking trans women, who will ultimately be the consumers of these materials. Next, we'll pilot test these materials through our collaboration with La Clinica and study how they impact service utilization. We can then continue to refine them and then use them as part of a larger trial in this area. So that really concludes my overview of this first project, which was recently funded. It's a one-year study with kind of a fixed amount of research funds to support it. And I'm going to go ahead and shift gears now to the second study. Is that good, Mallory? Okay, and then leave perhaps some time if we have for questions in between. All right. So the second one, really shifting gears both geographically and also in terms of, I was talking broadly about HIV services for women. I began talking about services for trans women, primarily Spanish-speaking Latinas. And now I'm really going to shift dramatically to look at young Southern African women, and young meaning ages 16 to 24, working with women living in South Africa and Zimbabwe. And I'm just going to take a moment here to talk about the HIV Prevention Trial Network Scholars Program. This is an 18-month program. I'm so excited about this, and I think it is a great opportunity for other early career investigators from backgrounds that are underrepresented in the sciences. So this funding, this scholars program is specifically for Latinx, Native Americans, and African Americans who are underrepresented in the sciences. And I think, you know, that phrase, underrepresented minority, is so odd, URM. But just as kind of a brief benchmark, myself as a faculty at UCSF, I'm part of, it's 1% of all the faculty we have at UCSF are Latina. And that is in a state where 40% of the voting population is Latinx. So sometimes people use the term historically underrepresented or historically disadvantaged, but we're still seeing really striking current differences in representation when we look at not only, you know, the overall population in the state, but who's completing doctoral degrees within the sciences and then who ends up as faculty. So this is a really important program that matches early career investigators with investigators, senior investigators on who have received, you know, who are leading HIV prevention clinical trials. And so for myself, it's an opportunity to work with new mentors. Sybil Hosek, who's on the lead team and investigator for the parent study, which is the HPTN 082 vanguard study that evaluated daily oral PrEP as primary prevention within a group cohort of young African women in, as I said, South Africa and Zimbabwe, and also an opportunity to work with Jen Velloza, who recently joined UCSF and Department of Epi and Biostatistics, and was a qualitative lead on the original HPTN 082 and has published extensively in this area. So this, this particular funding mechanism supports analysis of the qualitative data collected as part of this larger clinical trial, as well as protected time to conduct analysis, publish, and then attend different conferences and really develop networks outside of my home department. So I really appreciate this, this opportunity. A little bit about the parent study, HPTN 082. As I said, it was an open label PrEP study with adolescents and young women, 16 to 24, and 3 clinical sites, one in Harare, Zimbabwe, one in Cape Town, South Africa, and one in Johannesburg, South Africa. So to briefly go over the political and epidemiological context of this study, adolescent girls and young women in Southern Africa, Sub-Saharan Africa, still account for about 1 in 4 new HIV infections globally. And then if we look at the overall prevalence, it's about 15% for both countries in this age group. And women, by far, adult women shoulder the highest prevalence of HIV in both South Africa and Zimbabwe. So shifting gears and really looking at a very different type of epidemic within this context than what I had described earlier in the US and specifically Oakland, California. What we see here in South Africa and Zimbabwe is a primarily heterosexually driven context of risk, and particularly key in this group because this is the time that adolescent girls and young women are growing their families. And so PrEP also has the benefit not only of preventing HIV transmission, but allowing for conception at the same time. So that really makes it a particularly effective prevention strategy for people in serodiscordant couples or for HIV negative women who want to conceive. Since this Vanguard study, HPTN-02, and other clinical trials as well have been completed, we have really strong data about the safety and efficacy of PrEP as an HIV prevention strategy for young women. National policy in both South Africa and Zimbabwe supports the provision of PrEP to this age group at no cost. However, one of the strongest and truest lessons we know in public health is that it's not enough to have a biomedical solution. You really need programming that meets the needs of a particular group. So in this context in particular, we're talking not only about considerations around access, can people get to the clinic, but we're also really looking at the social and cultural context of PrEP use and sex and sexuality for young adolescents and young women. And so really it's not, the needs that a young woman who's still in high school or a young woman who's recently been married, just started a family, or just started a new career or job might have for sexual health. Again, beyond this idea of just abstinence, can be really tricky in terms of marketing and making that a safe and welcoming space. So the focus for this this sub-study will be to conduct analysis of the qualitative data sets that have already been collected, specifically to look for programmatic strategies that could increase participation among adolescent girls and young women, and to develop adolescent-friendly messages, evidence-informed, taglines, would you say, programmatic materials, advertisements that can be used. Billboards are still really popular both within Zimbabwe and South Africa for health messaging, for advertising, and really that address and assuage concerns, common concerns around PrEP, and that kind of emphasize or speak to people's motivations for PrEP uptake and persistence. So to conduct this under mentorship of the mentor team, both here in the US and in South Africa, with Witwatersrand University, to analyze these 75 in-depth interviews that were conducted in South Africa and Zimbabwe, 67 of which were actually serial interviews that were repeated at 13 weeks and 26 weeks with participants in the intervention arm of the study. So we have both a large 75 set of the preliminary interviews, and then a subset of which will also have follow-up serial interviews to read. They've all been coded. I'll begin with an in-depth analysis of, here, let me just jump here to this. Might be easier to conceptualize in this way, at least for me. So we have the 75 interviews, 67 of which are repeat from 3 clinical sites. And I think it's important to note that even within South Africa, where we have 2 clinical sites, one in Cape Town and one in Johannesburg, there's still very different socioeconomic and cultural contexts. Johannesburg is really a melting pot for the different tribal groups within South Africa. They all have strong representation within the metropolitan area of Johannesburg. There are 11 national languages spoken within Johannesburg, within South Africa as a whole, but primarily Johannesburg is where everyone intermingles. The rest of the provinces, for example, Cape Town is within the Western Cape, and it is primarily Xhosa. So that is going to have a very different cultural and social context than even the clinic we're looking at within Johannesburg. In Zimbabwe, we have two main tribal groups represented. Harare also is a real a mixing part for both groups, and will have a very different service environment than the two sites within South Africa. So the analysis will involve both a deep dive within each of those clinical sites, and then kind of comparing across them to see what kind of strategies might speak generally to adolescents and young women across this region, and then what might be more specific to the urban and cultural contexts that these clinics were located within. We also have observational data sets from all three sites. And so clinic activities in terms of literally the way that tracking is done to follow up with a patient over time and ensure continuity of PrEP or PrEP persistence. The different strategies for are there navigators? What are the clinic relationships and communications like with patients within clinics? Those observations really focus on the clinic environment and the clinic interactions with providers. Program activities can include things like adherence clubs, which are popular within South Africa, and I'm not sure if they were employed at the Harare site. Social events such as movie nights. Again, we're talking about youth here. So, what kinds of program activities were done to really engage people? What kind of support systems were there? Were there, serious discussions around romance? When we talk about PrEP, we're talking about sexuality, we're talking about romance, we're talking about desire and behaviors. So in what ways do these programmatic strategies speak to that for young women, and what can really be pulled out as recommendations for broader programming to reach this group? So I'll stop there and open it up to talk about either one of these or both together. I do, of course, want to acknowledge all the work from the original Triunfo team, Luis, Ariana, and Cynthia in particular, that laid the groundwork for the first constellation of studies that I'm nesting within. Always gratitude goes out to my primary mentor, Jay Sebelius, and my thought partner, Luz Venegas. We talked through all of this together, and her influence is everywhere. So thank you all to the participants as well. And I'll open it up now for some discussion.
I was going, Sophia, thank you for that. First of all, it's great to see what a wide range of contexts and locations and topics that you're working on, and congratulations on both of those highly competitive awards. That's fantastic. I want to move us on to the next presentation and then open up for questions at the end. So we're sure to make sure that we don't have too much of a time crunch, because I think people will have lots of questions. In the meantime, anyone, please put questions for Sophia in the chat, and Sophia can perhaps listen to the other talk and respond at the same time. We'll see. Okay, thank you, Sophia. Let's move on to our next pair of speakers that will be talking about one project together. So we have Dr. Emily Arnold, who's professor at CAPS in the Division of Prevention Science, and her research is primarily devoted to promoting health equity for ethnic and sexual minority communities, with an emphasis on collaborative research designs and developing and testing intervention programs. As an anthropologist with training in public health, Dr. Arnold has a great deal of experience in conducting and teaching others to do qualitative and mixed methods research, and has worked with various research teams as well as early career investigators, postdocs, international trainees, graduate students, medical students, and community members. So really training the future. She co-directs the NIMH Visiting Professors Program and the newly funded UGMA Mentoring Program. So she also leads the Northern California HIV Research Policy Center based here at UCSF. And I'm trying to make sure, and has a number of ongoing HIV related studies currently. She'll be sharing some of that with us, and has been working in COVID vaccine uptake science as well. And partnering with Emily during this talk is Dr. Lucia Abascal, as a physician and second-year global health PhD student at UCSF. She completed her medical training in Mexico City, where she's from, and a master's degree and global health fellowship at the Institute for Global Health Sciences, IGHS, here at UCSF. In the past year, Lucia has worked with the San Francisco Department of Public Health Contact Tracing Project, and has had multiple roles as a subject expert giving talks to different audiences. She's currently doing research on public health COVID-19 preventive measures for Spanish speakers in San Francisco, and has participated in other COVID-related projects in Mexico and California. And she also leads the Acceso COVID, is that right? A website that summarizes and translates up-to-date COVID research to Spanish to increase information dissemination in Latin America and other Spanish-speaking regions. And most importantly, Lucia loves tacos. Okay, so now I'm hungry, but we will let Lucia and Emily nourish our intellects and with their science instead of providing us tacos, which would be great. Okay, take it away, Emily and Lucia.
Thank you so much, Mallory. That was a great introduction. It's so nice to see you all on Zoom. I'm slightly missing the days of town halls when we would meet in person and actually eat lunch together, which makes me think that perhaps at some point in the future, we'll come back with an update and we'll bring tacos for that one. So Lucia and I are here today to speak with you all a little bit about a project that is funded by the CDC through our Prevention Research Center. So this is a supplement to the PRC Parent Grant, which was awarded about a year ago. And our work has been focusing on encouraging COVID vaccine uptake among Black and Latinx communities here in the Bay Area. I definitely want to acknowledge the amazing contributions of our wonderful team, including Lucia, who's been able to join me here today, as well as Andre Moriana, Chad Campbell, Gustavo Sojase, Barbara Green-Ajubo, Beth Bordeaux, John Hamiga, and Margaret Handley. Several of you are on the call today, and it's just wonderful to be able to represent this work. So just to give a little bit of context, some of you may be aware that vaccine uptake has remained lower within certain African American and Black and Latinx communities, particularly in Alameda and San Francisco counties. Looking at data with young people, we see disparities that track across the younger age groups, from pediatric vaccine uptake among ages 5 to 11, our more adolescent age groups from 12 to 17, and then looking at younger adults, ages 18 to 29, we see lower uptake across the region within these particular racial and ethnic minority communities. And these are also the same communities that have suffered disproportionate COVID related sickness and death over the course of the pandemic. A host of factors relate to the decisions to wait or forgo COVID vaccinations, which range from logistical or structural challenges to vaccine misinformation, as well as, frankly, well-placed mistrust or distrust of public health institutions and the medical establishment. We've been working very closely with community and public health partners who have been focused on creating access to vaccines in equitable and appropriate ways. So this is a two-phase study design. We conducted a series of observations as well as key informant interviews and focus groups during fall of 2021. Basically, we were funded in late May of 2021, right around the time that COVID vaccines were becoming available. And it was very apparent at the CDC that COVID vaccine uptake was going to need some additional support and research to make sure that it was equitably accessed across the US. And the PRC at UCSF is actually part of a much larger network of prevention research centers. There are 26 such centers across the nation. And what the CDC did is offered the supplementary funding to all 26 centers, asking research personnel to partner with public health departments. So this was a requirement of the funding announcement, as well as community-based organizations. So we are working very closely with Alameda as well as San Francisco public health departments, and then we have identified over the course of the research community-based organizations to also partner with, and I'll say more about that as we get closer into the details of the work. We used template analysis. So we followed Allison Hamilton's approach to rapid qualitative data collection and template analysis to really try to identify best strategies that could improve trust as well as vaccine uptake within these particular communities in San Francisco and Alameda County. On the basis of the formative research, we decided that it would be most appropriate and efficient for us to focus on two particular communities in each county. So we decided that we would work with Latinx communities, and in particular ESL, so English as a second language learners, partnering with Mujeres Unidas in Alameda County. And Lucia is going to share some of the more details about that work. And we're going to be working very closely with YMCA Urban to connect with African American and Black communities, in particular young men, to increase vaccine uptake and field a range of different interventions to promote vaccine uptake and trust in communities in San Francisco. So as I mentioned, we received our IRB approval in late August and went immediately into the field. We collected 2 focus groups and 2 in-depth interviews with unvaccinated as well as vaccinated youth, both in San Francisco as well as Alameda County. We also were really interested in perspectives from parents because it was very clear that we were going to be seeing vaccines very likely be approved for emergency use authorization during the time that we were in the field. And there was a lot of concern about how parents in particular of younger children might respond and whether or not they would be willing or not willing to get their children vaccinated. So we really made that a particular focus of the formative work that we completed last fall. In addition to working with community members and trying to elicit insights from people themselves, we also did several key informant interviews covering perspectives from public health department personnel, community-based organizations, vaccine pop-up agencies and clinics, as well as clinicians and medical providers who are actually working in communities. We did 16 of these in Alameda and 7 in San Francisco. And then we did a series of report backs to public health departments and our community-based colleagues to really brainstorm what the best steps might be. We have a manuscript in process that is being led by Dr. Campbell. So just to very briefly share some of our suggested routes for intervention strategies on the basis of our key informant interviews. One of the things that seemed to really become clear is that a number of people were going online for information about vaccines. And it was going to be really important for us to have an online presence and to also promote existing online content. So using social media to market particular kinds of messaging. So messaging that was provided by people who look like they're from the communities, who may actually be from these communities themselves, or just appear to be from urban communities who are people of color, frankly. So we were also told that it was really important to consider peer-based interventions and to frame COVID vaccine uptake, COVID-related health promotion within an ongoing and more holistic health education kind of a program. We also heard very importantly that it was going to be crucial for us to avoid scientific language and jargon, that we needed to really break things down into simple, more relatable ways, and to use often sort of relationships as a way to promote people's uptake of vaccines. So as I mentioned, we identified 2 partners to help us deliver community-driven interventions. And we've really allowed our community-based partners to determine what shape those interventions actually look like. So with the YMCA urban team, we're going to be working primarily within, actually it's a violence prevention program that works with young men in communities and creates sort of healthy norms within peers, helps to develop professional development. And then what we're doing is integrating COVID vaccine uptake and COVID healthy choices into this larger curriculum. And using peers who are involved with that program to also help train them to have conversations with other young people to promote COVID vaccine uptake in their own communities. As you'll see, we really have understood from our community partners that COVID is not necessarily the highest priority right at the moment. And so we've really needed to try to find creative ways to integrate COVID into existing social, educational, or health-related programming that's been ongoing. As part of some of that work, we're empowering lay people to also recognize mis and disinformation, to challenge it in their networks. As I mentioned, we have an online presence. We have established a website, but we also are doing a great deal of work on social media and messaging to correct misinformation about vaccines. We recognize that relationships and repeated conversations are necessary, and this is a process for many. I'm going to let Lucia now talk a little bit about some of the work that we're doing, particularly around myth busting.
Yeah, so as Emily mentioned, like 2 things that came up a lot, and I think we've been hearing also from our partners in other prevention centers across the country, is that one, people have competing health interests, right? So we've talked about COVID a lot. COVID has had the spotlight for a while, and now there's other things to take care of as well. No, it could be street violence, but also like diabetes, hypertension, whatever. And the other one is also like community-based organizations also want to continue doing what their original mission is, right? Going back and changing all their schedule, all their programming about COVID is not something like that's sustainable. So that's how we actually, the work we're doing. I'm going to talk specifically about the example with Mujeres Unidas. Mujeres Unidas y Activas is a women's group, immigrant women's group, Spanish speakers mainly, but they also have indigenous communities from Latin America. For example, they have a very big MAM, which are Guatemalan indigenous women. So it's mainly women, and their main focus is immigration rights, work rights, and work around that. With COVID, they did shift to include more COVID programming, but as time passed, they kind of got tired of it. So working with them, we're trying to integrate COVID into their existing activities, not to create like a new space for that. So part of that has been just being present to answer questions. I've given some talks to them about vaccines, but also about other public health and health topics. And also one of the most interesting, I think, and fun things we've started to work in is part of their general CBO activities is ESL classroom. So English as a second language, they provide this to the women that they work with for them to learn English. So using that model that they already have, they have students, we are trying to build a COVID into it, but speaking of wider health issues, right? So for example, we've talked about the right to health, and then we mentioned the right to COVID treatment, but also like maybe talk about in general, like prevention of breast cancer or other diseases, and then talk about COVID as part of an integral holistic view of health and not just as COVID as a silo. And then recently we started, and this was actually, we had like a workshop with the ESL classroom where we were working on how to identify fake information. We used COVID as an example, but it was not only about COVID, right? It was how to identify fake jobs, how to identify political misinformation. And it was actually fun because we got with a classroom, we got to apply this to the website we were developing at that time with our group. So we got like, do you trust, like we got the people's opinion about how trustworthy our website and our content was, which was really good. And right now we are moving to formalize that as more of like a research. So there's a lot of work out there about how to identify fake information, but it's all targeting high literacy groups and English speaking groups. So it's like, take these 10 steps and you'll know if that's fake information, but it's hard. So what I'm trying to do, and we're gonna try to do, is actually do some focus group to develop tools so that low literacy groups can identify fake informations. And I mean, our focus is to identify fake COVID-19 information, but the idea is to create a tool that can translate to other online information. So that's what the next steps we're taking. And yeah, we hope to create something that's very useful for them. And we're also with the YMCA group that we're just finalizing our contract with them, but we're going to target that more to youth-driven activities related to the vaccine uptake.
Thank you. Thank you so much, Lucia. So there's a lot of different pieces at play. We're going to be tailoring, obviously, these intervention strategies to the communities that we're working with and engaging with. We'll be evaluating those strategies in the coming months after they are being fielded. And we will look forward to coming back and reporting out on some of our findings. Definitely want to acknowledge the wonderful contributions of the entire team. And please make sure to check out our website. We have a QR code there as well as a link to the website itself. All right. We're happy to answer questions and look forward to hearing other people's thoughts or opinions about the work we're doing or the amazing work that Sophia is about to embark on herself.
Great. Why don't we open it up for questions for all three speakers for all three projects? I'll jump in. I'll get things going. So this is for any of the three of you that wish to answer it, or all of you. Now that you're starting the work, what is the biggest challenge you think in front of you with what you've got in front of you? What do you wake up at night and go, oh no? What do you think is going to be a hurdle you've got to figure out how to get over?
I can answer that from more of the activity intervention side of the work we're doing. It's just the changing nature of COVID and how that has. We started this I think the data collection last summer. So in that time, vaccines have been approved for teenagers, vaccines have been approved for children, boosters have been approved, second boosters have been approved. So trying to keep up with that and trying to keep up with people's opinions on that has been, I think, hard, a hard thing for us.
I think the other thing to just also add to that too is how politicized COVID vaccines have become. And so it's really been very interesting for us working here in the Bay Area, where there's, I would say in general, broad support for vaccinations, at least on the surface. Sometimes we have had to work really hard to recruit people who are chosen not to be vaccinated, to make sure that we are really including those perspectives in the work that we're doing. And so there definitely has been some challenges around trying to do that online and do remote data collection and remote level recruitment to try to bring out those perspectives and make sure we're including them.
That's great. Yeah, I would say, I mean, for me and for these two projects, that really for the one that involves the messaging and developing of Spanish language messages, the impact there with COVID again would be that the focus groups, particularly for this kind of thing, I mean, there's just so much that can't translate to virtual work. So I am really looking forward to doing focus groups in person and hoping that can still happen, because it's just such a great way to be able to like brainstorm things, literally collage images, work with different mediums to really co-develop those things together. So I'm hoping that we can continue to work in person. And I would just also say, frankly, and perhaps this is a little too personal, but always timelines, like keeping strong timelines with this is one of the things that really gets me when new projects come in. There was like, of course, the nice clean timeline that was included for both or for any of these in the proposal itself, but just ensuring to make sure that those are realistic and to keep abreast of that. Particularly both of the ones that I presented are short 1-year timelines. So getting all of that done within a short period of time is one thing that keeps me up at night. No, but I mean, just really keeping track of that is important. So I would say that. And I also had a question, but I don't want to jump in too much if other people do, but I'd love to hear around that, the strategies that you were talking about, Lucia, around helping people to discern between like kind of the quality and the validity of information sources. That just seems like it is so critical for COVID, but and even beyond, it's just such an amazing health literacy skill. And I was wondering if you all could say a little bit more about that.
Yeah, definitely. So I think we also thought it was like something that could include COVID, but was not COVID central. So it's like a hard skill you can, I guess, teach people, and there's not much out there. So if you Google like how to identify misinformation, there are pretty standard like checklists, but those are very high. It's like compare the URL and see if it ends in co or com, like things that are just like people are not going to do. Yeah. So I think first that's when the idea came to be like, maybe we should develop a tool that people with low literacy or maybe that are not primary English speakers can use. But we wanted to first understand how people actually trust information, no? Especially information that comes through social media. So we just developed the focus guide group, and it still focuses on the main aspects of information. So for example, source, messenger, channel, no, like different things that come into play when we receive information. And we want to understand how people judge and like, I guess, assign points of value to that to generate an idea if they should trust or not trust that. I don't know if that makes sense, but with the goal of like maybe creating a tool that summarizes all of this together. So we have like a checklist of these are the things, and maybe develop, I don't know, an infographic or something that people can look at and understand, like, oh, these are the things I should look at when I have, when somebody shares a piece of information in WhatsApp or in Facebook. And this is like, just like the basic things I should make sure the piece of information, be it a video, be it a text, be it whatever, has, for me to at least like say, oh, this is like trustworthy or not. I mean, there's not a lot of research. There's some research done on the political like on the political side of this, of how people trust political information, but not a lot on the health side. So I think we're gonna pilot to see if we find something cool.
Thank you so much for that question.
So we have 2 minutes before the hour. If someone has a quick question, and by which I mean hopefully has a quick answer, go for it. If not, but yep, I'll give people a moment to chime in. Don't see anyone jumping in. In that case, I want to again thank and congratulate our 3 speakers for their for sharing the work that they've started. And as you all, I think, promised, or at least as I heard, you all offered to come back and tell us what you find once you've done the work and done the analyses and figured out what they meant. We'll help you figure it out too. So we love that part of it too. So again, thank you, congratulations, and yeah, best of luck with the work. It's exciting and important and all very timely. So thank you very much.